Thank you all so much for being here. I am just delighted to thank so many of the Oregonians who are here today. They are patients, they are providers, they are home care workers. We've got folks from hospitals, we've got folks from insurers, we've got CCOs, coordinated care organizations, small business owners, public health directors, counties, tribal health representatives, and of course, consumer advocacy organizations. This group stands with me today to prove that healthcare touches each and every one of us. We know the Affordable Care Act works in Oregon. It's worked so well, it's considered a model system around the entire country. We have changed lives by expanding access to 95% of adults. Yay. What's even more special, 98% of our children now have access to care. Yeah. We have changed families by providing more than 23,000 jobs. These are especially important in rural Oregon, which is just starting to recover from the economic downturn that started over 10 years ago. We have changed communities by generating billions of dollars in economic activity. By all accounts, the Affordable Care Act has been a huge success for Oregon. We've been able to provide better care while keeping costs down. The proposal to replace the AHCA will punish Oregon for our success. Last week, when the proposal was first released to the public, I directed the Oregon Health Authority and the Department of Consumer Business Services to evaluate how it will impact Oregonians. Our report found that for every step of progress that Oregon has made, this proposal will take Oregon 3 steps back. It will triple the number of Oregonians who are uninsured. More than 400,000 Oregonians will lose health care coverage. This bill is not about improving health care. This bill is about giving tax breaks to the wealthy. It will have a greater impact in rural Oregon than in the urban parts of our state. More than 1 in 3 people in our central, eastern, and southern counties depend on the Oregon Health Plan for their care. It will cost jobs and put a damper on Oregon's economic growth. The 23,000 jobs the AHCA created will be lost, along with an additional 19,000 jobs that support the healthcare industry. We cannot afford to lose 42,000 jobs in the state of Oregon. This is absolutely unacceptable. This bill will pull the rug out from under Oregonians, from families to doctors to hospitals. And some of them are here to talk with you today. One of them is Brandy. She came here from Lincoln City. We just got the chance to meet, and I frankly cannot believe the challenges she faces as a mom. She has 3 young children. The youngest has cystic fibrosis, and her oldest has been diagnosed with behavioral health issues. If Brandy loses coverage under the Oregon Health Plan, medication would cost her family more than $4,000 a month. $4,000 a month. They simply can't afford it. Without medicine, Brandy's daughter would struggle to swallow her food. And her son would lose the therapy and treatment he needs to have a healthy future. This administration promised that no one would lose health insurance coverage. I urge Congress to consider families like Brandy's when voting for this proposal. I urge Congress to consider the dreams it will destroy by pulling these jobs from the families that need it the most. I urge Congress not to throw our Oregon and the rest of this country into uncertainty, and instead, I urge Congress to support the health of our residents, our communities, and our economies. We all stand here today to say any changes at the federal level should move Oregon forward, not backward. Do you agree? I'd like to thank Brandy, Diane, Dan, and Morgan for joining us today, and I look forward to hearing their stories. I'm going to be taking their voices and their stories and this report to Washington, D.C., so that Congress knows exactly how their political games will impact the lives of Oregonians. Thank you. And I'd like to turn it over to Brandy.
I don't know if she'll let anybody.
Okay. I was going to offer too.
Hey, you going to turn around and say hi? No? All right. So my stories, it just kind of got really serious almost 3 years ago when Luna was diagnosed with CF. Her medications in a year are about $55,000. That's double my husband's income. My son doesn't yet require medication, but we're getting to that area if the therapy doesn't work. Now, if we lose our coverage or certain areas of our coverage, I can no longer get my children what they need. And not being able to get them what they need, they're not able to survive, they're not able to become functional people in today's society or in tomorrow's society, since they are our future. And my daughter could potentially die if she doesn't get the right treatments or the right care. So the AHCA is definitely something that has helped us and needs to stay in place.
You know, that's really what it's all about right there. I'm Dan Grigg. I'm the CEO of Harney District Hospital in Burns, Oregon. And I'm going to admit up front, I haven't always been the biggest fan of the AHCA, but it's been a great thing for our county, for our community, and for our hospital. In our community, Harney County has about 7,500 residents, and 800 of those now have coverage thanks to the Medicaid expansion and AHCA. And that means 800 people who no longer have to put off getting health care, no longer have to use our emergency department because they can't afford to go to the clinic. And so that's been a tremendous blessing to them and to those that we associate with. From a hospital standpoint, what Medicaid expansion in the AHCA has done for us is given an increased focus on primary care. Traditionally, hospitals who have the specialty services that do a lot of surgeries, they get the benefit of the extra funding, where the primary care hospitals, such as those in rural Oregon, have had reduced funding. And thanks to the coordinated care organizations that Oregon has set up, and I'll speak particularly the Eastern Oregon CCO, since that's what I'm familiar with, they have put a lot of extra funding and money into primary care, preventive services, and really allowed us, as a healthcare provider, to increase the number of doctors that we have on staff. We went from 3 full-time physicians to 5, and it'll be 6 here coming up. We've added psychological services, mental health services as a result, and also several community health workers who work with our doctors and with our patients out in the community to help keep them healthy and safe. The American Health Care Act, while I understand the intention of it, which is admirable, we can't lose some of the great things that have happened because of the AHCA, such as the funding from the federal government that's helping the CCOs stay afloat, the impact and the emphasis on primary care and taking care of families. If the reports are true and the number of people lose coverage because of the American Health Care Act, we will once again have families and neighbors and friends who will put off getting care, who will wait because they can't afford it, and end up showing up in the ER much more worse than they would have been if they've gotten treatment earlier. They'll miss out on the preventive services that they get now, and eventually that will cost our country more than it does to do the preventive care. So while not everything in the AHCA is bad, I hope that they can retain at least the coverage for members of our communities and our state, as well as the federal funding to help us keep the CCOs and the primary care focus that we have now. Thank you.
Good afternoon. Thank you, Madam Governor, and other distinguished guests for allowing me to speak about how the Affordable Health Care Act has helped me. I'm Diane Goodmanson, a 58-year-old chiropractor yoga teacher, self-employed for 34 years. For many years of my career, I enjoyed prosperity and comfort, as well as the ability to purchase insurance for my family employees. Then I experienced a series of hardships, including a child with autism, a divorce, the recession and loss of property, a back surgery, and a flood in the building which contained both my home and businesses. All of this threatened to totally derail my life and career. During this time, I lost nearly everything: savings, retirement account, nearly lost my home and business to foreclosure, and of course lost my health insurance in 2009 because I was unable to pay the $850 a month premiums. Then, due to my pre-existing back surgery, I became uninsurable for 4 or 5 years. As I fought desperately to get my life and career back on track, pay off debt, and repair my building, both of my hips began to bother me, and they rapidly worsened, such that I nearly lost my ability to walk. I hobbled with a cane and had to use a wheelchair cart in the grocery store. When the Affordable Care Act was passed, and with the help of my wonderful insurance rep, Diane Falagowski, I obtained insurance again through the marketplace, which allowed me to get an MRI and find out what was wrong: advanced degenerative arthritis of both hips. 1 year and 6 weeks ago, I had 2 hip replacements at once. I now see patients 7 hours a day, practice and teach yoga again, cross-country ski, bike, work in my garden, and even climb ladders and work on repairing my building. In January, I took my daughter to Seattle and walked all over downtown Seattle for 3 days. The Affordable Care Act literally gave me my life and career back. Without it, I would likely not be working or walking. I would have probably lost my business and home. Thank you, Governor Brown, and everyone else who is here fighting for millions of Americans like me to keep our affordable health insurance.
Thank you, Governor Brown, for having us here to speak today. My name is Morgan Wharton, and I'm the clinic manager at Lancaster Family Health Center, located here in Salem. And Dan talked earlier about the importance of primary care under the Affordable Care Act. So my clinics are federally qualified community health centers, and we were just able to open up a second site here in Salem to take care of patients. So we provide medical, dental, pharmacy, and WIC services to over 9,000 patients, and 5,000 of those are Oregonians enrolled in the Oregon Health Plan. And many of those 5,000 patients were uninsured prior to the Affordable Care Act. Since the implementation of the Affordable Care Act, we have been able to enroll many of those patients into the health plan. And we saw many new patients come to our clinic to receive health care for the first time in years due to their previously uninsured status. These patients had many uncontrolled chronic conditions, leaving them very unhealthy, and many of them relied on the emergency department as their only source of care due to their lack of insurance. After the Affordable Care Act, these adults were able to receive preventative and chronic health care treatments at our clinic. Furthermore, the Affordable Care Act enabled our clinic to add integrated behavioral health providers and nutrition services within our medical teams to provide whole person health care to our patients. And due to the Affordable Care Act, these teams can provide more integrated and holistic primary care services to more patients who now have access to these services. Maintaining the Affordable Care Act is essential for my community health centers and others across Oregon to continue improving the health outcomes and lives of our patients and address more than simply the medical needs affecting their health. Thank you.
Thanks everybody for joining us, and thanks to Brandy, Morgan, Dan, and Diane for commuting all the way to join us this afternoon.
A great honor.
Here in the conference room waiting for you.